There's a stark warning tonight that millions of children in Yemen could be pushed to the brink of starvation unless international aid is dramatically stepped up. It comes from UNICEF, the United Nations Children's Organization. The country faces the world's worst humanitarian crisis, with the COVID-19 pandemic compounding the effect of 5 years of civil war. Houthi rebels backed by Iran have been fighting Yemen's government, itself backed by a Saudi-led coalition, which is supported by the US and the UK. 2 million of Yemen's children are malnourished, and 1.7 million have been forced to flee their homes. With only half of the country's health facilities in operation, one child dies every 10 minutes from a preventable disease. Our Middle East editor Jeremy Bowen sent this report, and I must warn you, there are distressing images right from the start.
Selwa Al-Odabi is 5, the same age as the war. Selwa has cerebral atrophy, brain damage caused by malnutrition she's had since she was 2 months old. The vicious mixture that is destroying Yemen is killing her. A man-made war, man-made hunger, and the coronavirus pandemic's grip on a broken country. Selwa's parents are among the 2 million Yemenis who've been forced to flee their homes because of the war. Her father, Ibrahim, says they can't pay for any more medical treatment. Selwa's not the only one. UNICEF says malnutrition has caused permanent mental and physical damage to 45% of Yemen's under 5s. This is Aden, better supplied than most parts of Yemen, but still living on the edge. There's food, if you can pay. Many cannot. It's 20% more expensive than a fortnight ago because the currency has crashed. Yemen is an easy target for the virus. Its citizens' immune systems are exhausted. Their healthcare system is 50% destroyed by the war. Some provinces have 2 hospital beds for every 10,000 people. Dr. Amr Qasim Al-Turki filmed this for us in a COVID-19 ward at his Better Off hospital in Aden.
Most of the patients not accepted in the hospital.
Rich countries could buy thousands more ventilators. Dr. Amr says they have to turn away most of the patients whose families beg for them to be treated here. This woman had a chance, a bed in a hospital run by the medical charity MSF. They couldn't save her. In Yemen, 25% of people with confirmed COVID-19 die, 5 times the global average. It's estimated Yemen already has 1 million cases of COVID-19, 3 times more than the UK, in a population less than half the size.
It feels like the end. It feels like a calamity. They think the world has forgotten them. It's chaotic and anarchic and desperate.
Are they right to think that the world's forgotten them?
And unless action is taken straight away, we are going to see a tragedy of globally catastrophic proportions.
Making everything worse, separatists are fighting a new war to end South Yemen's union with the north. It's on top of Saudi Arabia's intervention 5 years ago to fight Houthi rebels aligned with Iran. In the desert, Saudi troops are with the southern separatists, trying to observe a ceasefire that so far does not exist. The UN is cutting its aid operation because donors have promised only half the funding they gave last year. UNICEF says that in a single day, a child in Yemen will suffer more injustice and hardship than most people face in a lifetime. When Selwa Al-Odabi was a baby, her parents had to escape with her from a hospital bombed by the Saudis in a raid that killed 19 civilians. Now she's 5, Selwa's family have to try again to save her. They feed her with sugar and water, love and prayer. That's all they have. In this war and this pandemic, it might not be enough. Jeremy Bowen, BBC News.